Hello, I'm Dr. Eli Whitney with the Heart and Vascular Institute of Texas. I want to talk about hyperventilation syndrome. It's a disorder in a person's breathing and is easily treatable. Hyperventilation, or breathing too quickly, produces weakness, shortness of breath, lightheadedness, numbness, and occasionally tightness or pain in the chest. Why does this happen? Well, under normal conditions, there is a one-for-one exchange of oxygen and carbon dioxide in our lungs. That means that there is a steady balance of oxygen levels and carbon dioxide levels in the blood. If a person unknowingly breathes in more air than is necessary for the amount of oxygen burned, carbon dioxide will be blown out of the body. When this occurs, the levels of carbon dioxide in the blood will fall and the unpleasant symptoms appear. Carbon dioxide is necessary for the proper balance of acid in our bodies. The acid level in our body affects the arteries feeding our brain. Whenever carbon dioxide levels fall, artery spasms or constriction will occur. The more the carbon dioxide level falls, the greater the spasms in the arteries feeding the brain. When the arteries feeding the brain spasm, the delivery of oxygen to the brain is decreased. When this occurs, the brain doesn't work properly, which produces uncomfortable feelings described earlier: the weakness, shortness of breath, lightheadedness, numbness, and occasionally tightness or pain in the chest. Unfortunately, when most people get these unpleasant feelings, they tend to increase their breathing. This causes a vicious cycle. When breathing is increased, it causes a further drop in carbon dioxide levels and a further drop in the blood flow to the brain. This worsens the feeling of numbness, chest tightness, dizziness, and the like. When experiencing these symptoms, a person usually increases breathing, which, for many patients, leads to total incapacitation and the need to lie down. This breathing problem is not psychological. Oxygen to the brain is really reduced, and the dizziness, weakness, and other discomforts are real. Some patients have actually suffered a broken arm, leg, or hip from passing out due to hyperventilation. The weakness and numbness caused by this problem can even produce symptoms of a stroke, with half of the body being weak and numb. The entire process usually starts out due to pain or stress, which leads to the increase in breathing. This increase in breathing is so mild that no one can tell that it is occurring. But the longer the normal balance of breathing is off, the greater the drop in carbon dioxide, producing the brain artery spasms. This is followed by all of the bad feelings, and the vicious cycle gets into full swing. The way to diagnose the hyperventilation syndrome is to open the mouth wide and force air in and out as fast as you can for 2 minutes. If this forced breathing produces your bad feelings exactly, then hyperventilation is causing your problem. Therapy for hyperventilation is to restore your normal carbon dioxide levels as quickly as possible. What clearly doesn't work is trying to relax and taking slow, deep breaths, since this usually makes things worse. The best way to restore carbon dioxide levels is to place a small brown paper bag loosely around the face and mouth and rebreathe some of your exhaled air. This will help you retain carbon dioxide, and your levels will return to normal within several minutes. This will shortly be accompanied by you feeling normal. I hope this educational video has helped you better understand the nature of hyperventilation and what you can do to prevent it from becoming a problem in your life. This is Dr. Eli Whitney from the Heart and Vascular Institute of Texas.